Hello there. Welcome to One on One right here on Metro Television. My name is Bridget Otu. Thank you so much for joining us. If you're a nurse, maybe this is the show for you. If you're an aspiring nurse, this is it. If you're a nurse who has sat home for 2 years, 3 years, and is confused as to why you have no posting and government says that the payroll is full, this is the show for you because today we're engaging the Private Health Association of Ghana on their contribution to easing the pressure on government. What has the challenge been so far? Why have they not been able to persuade government in allowing or in employing more nurses to be posted to the private health facility? And I'm excited to have the Vice President of the Private Health Facilities Association of Ghana, Samuel Boakye DONKOR, in the studio with me. Thank you very much for joining us on One. I just want to get an understanding of, the Private Health Association of Ghana. What's the membership like and what do they do? I mean, yes, I know you run private health facilities, but what do you do to complement the work of government?
Thank you. Greetings to everyone. If we say private health facilities, we are individual-owned facilities, which includes primary hospitals, clinics, maternity homes, diagnosis centers, and some pharmacies, right? We operate alongside the Ghana Health Service and QUISA and they say the CHAG.
So when you're saying it, for persons who are not in the medical fraternity, you'd have to explain the CHAG and then the QUISA.
So the CHAG is the Christian facilities,
Health,
if you have the one close to my place, St. Dominic's Hospital is one.
Right.
Yeah, and then we have the police hospital, military hospital. They also form another. Yes, they form another group. Mm-hmm. So we are private, solely private for individual, not for any association. Formerly, we were not together. We were doing. Everybody was doing his own job somewhere, but we saw it that there's a need for us to come together, so that what others are benefiting from government, we can also benefit, because we are actually many than all the other groups. You see, we are. If we take Ghana Health Service, the second largest is a private group, very, very many. And we saw that there were so many, I would say, injustice for us. The business environment to operate as private was so bad for us. The regulators will come and so many issues.
What are the issues? When you say the regulators come, you mean government?
Yes, government. The regulators are government. We have HEFRA regulating us. We have EPA regulating us. We have fire service. We have NHI. All these people are regulatory bodies that regulate our activities.
Sure.
So when in fact, they are laws, and I would say the way they operate with us was really unfavorable, and it's still unfavorable.
How? What do you mean by the way they operate? EPA Fire Service, I would think they are checking for safety. EPA is checking the environment, making sure that everything. What do you mean by it's unfavorable to you?
Let's take EPA. They have done well. We sat down with them and they listened to us, and I think that's how Ghana should go. You see, we find the fault or the mistake at the grassroots, we bring it to authorities, we sit down, then we come out with a good solution for us to go. EPA was charging anyhow. You can see a facility in Accra, maybe 10 beds. You see, just OPD. EPA can charge about 4,000 cedis. The same facility with 10 beds, the same category in Kumasi, will be 1,500. So we saw how are they operating. Then we met them, and they saw that yes, what we were saying was correct. So we sat down, and then we put all the facilities in groups, minor, micro, major, and co. And we've done that. And so for now, if you are part of our association, you just go to EPA. You say you are part of private health. What you are paying is okay for us. It's so good for us. And that's how we want to sit down with all the other regulators.
Okay.
So that we
what, for instance, I mean, if somebody is in Accra operating a 10-bed, like you said, and then in Kumasi, and they were paying varying, amounts, say 4,000 and then 1,500 cedis, what reasons accounted for that?
We didn't know.
What did they say? When you said you engaged them, what
yes,
did they say?
Yes, we engaged them, and they were there. They themselves didn't know that was going on. You see? And we said, how can I pay 4,000 here in Accra the same bed capacity, maybe the same services, then in somewhere I'm paying 1,500. Now we saw that in a facility in Obuasi, 100 bed was paying 2,500, and a facility 10 bed in Eastern Region was supposed to pay 3,000 cedis, and that's friction between EPA and our group. Right. So we went to them, and I thank God they were so nice. They listened, and we moved on. We put all the facilities in groups, number of beds, what you do, per your level. Then they accepted. So now the amounts they are giving us to pay for the inspection fee and for the retention, very perfect, very good. We are okay with it. Okay. All right. Other agencies, no, they will tell you it's by law. So I asked myself, laws.
So by that you mean fire service?
No, fire service. HIFRA.
Okay. Well, what specifically do they say when they say it's by law? In other words, the law stipulates how much they should charge you, or how they should regulate you, and then they can't do anything.
The law
I want
tells
to understand that.
How they should regulate us, how much they should charge. You see, and I always tell them, the laws were made for us. All right. So if we are moving forward and we see the law is killing us, has become a killer, because when the laws were made, maybe Ghana we were about maybe 5,000. Now we are moving to over 30,000.
Yes.
So can't we change the laws?
For example, for instance, bushfire. The law says that if you burn somebody's farm, you pay 10 cedis. And this law was made so many years ago. Imagine burning, a cocoa farm, and then the law says 10 cedis. It doesn't make sense. So I agree that as time changes, you change to meet the needs and the population of the people. It makes a lot of sense. But why are they so reluctant to review it? What reasons do they have?
They said it's by law. We have to go through Parliament. We have to go here, and you go there. You don't know who to see. You see, I have issue. But
that's why you are an association.
Yes, I have issue with CEOs of agencies. And
MMDAs.
Yes, directors and all this. I have issues with them.
Why? What issues?
Like Senate, for instance. I always say Senate because Senate are people who use court actions to destroy jobs. For that, I will say it again.
How so?
For instance, let's take our case for example. I'm working under NHI. NHI says 3 months before I will pay you. That means with a 2 months interval, I have no money to pay my Senate. I'm not even paying my salaries. And the law is, if I don't pay salaries, I don't pay Senate.
Right.
But Senate law says that every 14th, you have to go and pay the Senate. If you refuse to pay, there's a penalty that you have to pay. But me, NHI is paying me once in 3 months. You see it now.
And sometimes they don't even honor. It's not like the 3 months they pay. Sometimes it can go a year.
I'm coming there. I'm coming there. You see, that is NHI law. So those two laws, they don't really work together. For first, you see, they don't work together. Right. Now, NHI will waste your money or will waste time. That gap will be a year. As I speak to you now, we have not received December 2021 money. Wow. So it means that from January up to date, you haven't paid salary. You have not been paid. So you haven't paid your Senate. Is it the fault of the provider? But Senate law says you have to go and pay. And if you don't pay, they take you to court. And as I speak, some of us, we owe only penalty over 60,000, 70,000. And it keeps rolling. So can't we change this law? Because the Senate laws were there before NHI. And when President Kufuor started NHI, it wasn't like this. It was really cool. He was paying. So we didn't have we didn't feel that.
And then the number of people who were dependent on the scheme increased.
Good.
Pressure.
NHI was paying us from President Kufuor, and that man, I always loved him, and I will ever love him. He was paying the NHI, so we were also paying Senate. But other, President who came, they don't just pay. I will say that. And so he's taking us to court. Our working capital is now off. Now, no private facility has money to pay even that penalty, or even has a working capital to work. All because Senate has taken all their money from us. And they keep taking. We are all in court now, as I speak to you now.
So, but then what would you say to people who would say this? If you don't have money to write a private health facility, then you shouldn't. You should not be solely dependent on the NHIA.
That is the law. People come to the facility with a card.
You can't demand cash for it.
And per the law, you are not supposed to take money from them. Now people are taking money because NHI is not paying. And if the facility don't take money, they can't operate. Simply can't operate. Because a day, like one of my facility, if I sit down and I calculate, I do the estimation, every day I need about 8,000 a day. With lights, drugs, non-drugs, which goes on 8,000 a day. So can I survive 8,000 a day without payment for 1 year? How do I run the facility? How do I save lives? You see now? Yeah. So our major issue in this job is delay in payment of NHI. And that triggers the whole troubles for us. Because that will know you can't pay your nurses, your doctors, you can't pay your bills, your light bill, your taxes, you can't pay anything. You just be there. And the law will tell you don't even take a coin from anybody, provided the service that you are giving the person is under NHI. Don't take.
Has the private health facilities, for instance, you've mentioned the issue of EPA where you have engaged them. Has the private health facilities, again, tried to engage SNIT?
Several times.
What do they say?
By law. It's by law. They have to take. That's what they say. So we wrote.
So in other words, they are not trying to apply common sense to it.
No. That's why I say I have a problem with CEOs and directors. You see, if I'm a CEO, if I'm a director, you sit in the office there, you may not know the actual problems on the ground. All right? Okay. The workers on the ground may bring you the issues. Now, when it comes to you, the laws were made for all of us. We can't sit down for the laws to kill us and for the laws to destroy jobs. Because we always complain, no jobs. Police students are coming, university graduates are coming, even these SS leavers are also coming. People with PhD, people with masters, they're all coming in the system. A year, how many people come to school? From all angles, medical students, whatever, accountants. But in our setup, we employ accountants, we employ an administrator, a lab person, a pharmacist, doctors, nurses. We employ all these people. And all these people come out from school every year. Can government absorb all of them?
Payroll is for finance minister.
Government can't absorb them. It's a private man who will help the government, who will help the country to develop, because we pay taxes. But you see, our laws are also killing the private business in Ghana. Our own laws. And I don't see why a CEO, a director, sits in the office and take delight in applying certain laws that kills business. What kind of attitude is this? So can't we change our mindset? They have brought to the issue. These people are not they are not able to pay their Senate. You ask yourself why. You go into details. These are the challenges. You are the CEO, the president that's taking you there. You as a director, you are the boss there. Take it to him. Take it to the appropriate place. These people are not able to pay because of this, that, and that. Why? NHI is not paying them. So this, what can we do to them? Should we still continue to charge them penalties? Or we wait, NHI pays them, we take our actuals. What if you say we want to take them penalty? We are taking their capital, their working capital, we are taking from them. So eventually, their job will collapse. If the job collapses, those people there, where are they going? Are they coming to add up to the unemployed for the government to build facilities to employ them? No, you go elsewhere. Government is not building facilities. Why, if I'm a government, why will I build a hospital? Why will I go and borrow, if not because of politics, to come and build a facility? Why? Because the public facilities are not paying taxes. Maybe before government pays me my NHI money, 7.5 withholding taxes held. I pay payee. All right? I pay payee when I'm paying my salary. So look at the taxes that the government gets for me. All those nurses or all those facilities that you are building, they don't pay tax. They pay their own money to them. So are you getting money from them? No. Where are you getting money from? The private. I need the money to develop. So why don't I give a very good environment for these people to operate so that I can get my big cash for my development? But laws, CEOs and directors will sit in the office, apply laws to kill the business, so that we also sack all of them home. For me, I was having about 80 people as my workers. Due to these challenges of SNIT and NHI delayed payment, I've sacked all of them. It's not me alone. We keep reducing them. Because you sit down
How
there.
can you run a facility by yourself? I mean, you can't do it. When you say you sacked them, how?
Oh, then there's some workers, maybe at the OPD, I have to maybe use about 4 people. I'm not using 2. Okay. Right? Maybe per HIFRA standard, if you are a hospital, you have to use 24 nurses. We can't pay them. Simply, even if they are at home and you want to employ them, how can we pay them? If one nurse is taking 1,000 cedis a month, for them alone is 24,000. Then you have 3 doctors. If each is taking 7,000, how much is that? Other departments have not come. And NHI will,
and then bills.
NHI will keep your money for 1 year. Even if you have money full of this room within 6 months, all finish. All the money will get finished. So how do you then operate? If we say you want to, what's with the private? Honestly speaking, we don't want to even take a coin from a patient. Madam, if we're in a hospital and you see pure poverty, you see, some of us, what we see, you sometimes have to dip your pockets and even pay for the patient. You see a patient dying, you write a drug for the patient to go and buy. The person has not even a coin to buy. Can you look at this person to die? You can't. As a human being, can you look at your fellow human being to die? We don't want to take even a coin from anybody. But the situation we find ourselves now, Senate alone will let you take money. Senate alone. GRA also come with their issues. Then light bills. What even is painful in life is you'll be in the theater saving life, somebody is on machine saving life, then you only see somebody in front of your meter. I mean, putting your life off. Why? Because you are owing. So whether the person dies or not, they don't care.
Is this not an issue of inefficient running of your facility instead of lack of money? How are you unable to pay your light bill? I mean, if you plan.
How do you plan?
So you don't have any capital that's like surplus, regardless of
finished.
What?
You started the business with about 10 billion Ghana cedis. Okay. You have not been paid for almost a year. You keep paying bills, you keep paying salaries, you keep buying drugs. You keep doing everything as standard. You keep your hospital as standard. Within 6 months, your money is finished. How do you get money again to continue? That is the issue we find ourselves now. You see, we want to work. If we are being paid, I don't think you have one person to go to the government facilities. Because we really want to work to support the government in terms of unemployment, in terms of, standards, good care. You yourself, if you are sick, you go to the private facility. Mm-hmm. Yeah, why don't you go to the public facility?
I don't think it's because they are not professional or they can't. No, but the private health facility, in emergency situation, they send you to Kolebu. Because you don't have all the facilities.
That's what I'm saying. That if you are being paid, if you are being paid, the government is paying, NHI is paying all the time. Mm-hmm. We will set up, big facilities with everything. Nobody will travel outside the country. I'm telling you. Now, as we said now, we have some NGOs who are ready to come to our aid, give us machines, build ultra-modern facilities for us. You look at the quantum of money in it, you look at how NHI pays you, you don't love to go. You are afraid to go. Because you are afraid you go for this huge thing, when are you going to be paid to pay them? What is maybe a loan, and you're going to take this machines on credit. Right? Even on Wednesday, we are meeting some at Kimpiski from US. They are ready to give us whatever it is. Give it a standard pay like US, other countries. And they want to push it to private. We are ready for it. You see, but we are working on that NHI. You see now, look at how many months are being reimbursed. And maybe that money, that facility you are taking is a loan.
This issue of the NHIS delay, it's something that's been going on for several years. What reasons account for it? Is it the government doesn't have money? Is it the numbers have gone up? The bills are too huge, and so they're unable to keep up? What has been the singular reason they've given?
NHI as an organization has no issue. I always say Dr. Koboy, when he just came, I love that man so much. He's ready to work. He's with us. When you call him, he's close to you. He understands your issues and he will just console you. We are working on it to come and blah, blah, blah stuff. Any child does not have issue. Ghanaians paying the levy, we don't have issue. But you are paying. As you said, you are paying. I'm paying. Everybody is paying. But how this money will be released from the central government to NHI to pay us is the issue.
Because central government pockets is overstretched.
Madam, that's the issue. You see, NHI, anytime I go there, you know, when they cry, I cry with them. When we are crying, they cry with us. Because they know how expensive healthcare is. They are aware. They know. Most of them there are medical officers. You see, if you go to Dr. Goboy himself is a medical officer. I mean, Madam Adukobia she's a midwife. They know. They have been in the facilities before. They know what goes in there. I mean, and what comes out. They are aware. But then, how for them to give us the money? I mean, for government to pay them, and for them to pay us, is the issue. And we do not understand why NHI levy is there. We are all paying and doesn't go to NHI street, but has to go to the central government before the money is released to NHI. We don't know why that is happening. And that is crippling health services in Ghana.
Okay, so on that very note, Samuel Boachi DONKOR, the Vice President of the Private Health Facilities Association of Ghana, we're taking a quick break. When we come back, we'll look at, despite all these challenges, they say they are still ready to help government to absorb some of the nurses who have sat home for several years without any work. How are they going to pay them? Welcome back to One on One. My guest is the Vice President of the Private Health Facilities Association of Ghana, Samuel Boachi DONKOR, on the issues within the private health sector, how government can complement their work. But currently, it looks like government is actually the biggest challenge to them thriving, including other government agencies. You heard him, he mentioned SNIT. He's talking about the issue of EPA, which they have resolved, and he's quite happy with that. SNIT, not so much. GRA is there, but they have to pay their taxes. I mean, that's one. I don't know how. I mean, you have to pay your taxes. So what's the issue? What's the issue with GRA really?
Nobody. How can you be in the country without paying taxes?
Yes.
No, you can't be working without paying taxes. Yeah. But then, our money to pay the taxes locked somewhere. The same government. So pay me, I pay. My government says I won't pay, but the same government says I'm taking it.
So do you go say months without paying salaries?
As I speak to you now, some 8 months, 6 months, we have not paid salaries.
Wow.
I'm telling you. The situation of the Ghana is very bad. Though. It's very, very bad. It's not that something we should take for joke or 8 months, 6 months, 5 months unpaid salaries. Look, from January up to now, we're in the 8th month, right? Yes. No money from government.
And from December, that means 9 months already.
Yes. Some of them, even they still have their September 2021, October 2021, outstanding in it. They haven't paid them. Up to date. Can we be here without payment for 2-3 months? You kill your CEO.
Oh, we won't kill our CEO.
Well, but you see, but the people were working with us. Sometimes I pity them. If I go to my facility, sometimes I cry.
So what do you tell them? How have they been so cooperative?
They know. They know. So maybe you trying to.
So as soon as government pays, do you pay lump sum to all of them?
How do you pay lump sums? You have about 1 year, 8 months arrest with the government. Government will only pay one. And the one.
So when government pay, how do they pay? No, break that down. I want to understand.
The government.
They owe you 8 months. How will
you to use the 1 month to work for 8 months? It cannot be possible. But you owe your workers for that 8 months. You have not paid them. You've taken drugs from Tobinco, Ozone's chemist. You bought lab reagents, non-drugs, light bill, SNET, water bill. Some machines may be broken down. So you see where I'm coming from. All this go inside the 1 month pay for you for that 8 months.
Also, government will pay the 8 months. When government is, they'll pay just for one month.
But they just paid December to us. They just paid December. About last week they paid December. December 2021. So if anybody goes to, it's the whole country. You see, but the problem with the public facilities is that No ECG man go to disconnect their light. Government take their SNET from source. They don't have issue with SNET. You see, government give them medicine for the medical stores. It is so medicine is constantly supplied, but from A to Z, private, everything is you. So imagine for a year you have been paid once. For 8 months you have been paid once. How do you survive? Even some of us who have gone for loans, ODs from banks, once the money comes, the bank has taken the money. So you are still zero. You've gone for loans.
Then why are you still in the business? I mean,
That is
that's a silly question.
But
issue. I want to know why. Why is
that is the issue?
Yeah.
Where we are, where some maternity homes are, if they should close down right now, the way people would die, we can't. Where, for me, maybe I think about maybe 60 patients a day, 70 patients a day.
Which location is it?
Yes,
it's
Amankese. Yes,
wow.
Multiply by 30. That's a month. I know some facilities, private facilities, who
that's 1,800.
Yes,
1,800.
some facilities who do 200 a day, 150 a day. Their bed capacity is over 200. Private.
So they're supporting.
Kennel, Nimwa, and so many big ones. Talk about Nyaho. Talk about La Paz community, Cresta, these big ones. You see, when we should all fold up, apart from the unemployment that our workers will come and add to the government, the life is a problem. I travel a lot across the country because I'm the vice president. If you look at where some of our maternity homes mothers are, you cry. And this same mother, Senate person goes there to take them to court. Very pretty in Ghana. This same mother saving a life, ECG goes there to disconnect their life, their light. This same mother, GRA is taking them to court. This same mother, pharmaceutical company, he has taken his drug for almost 5 months, he has not paid, is taking them to court. One CEO, we have caught someone from Senate, from GRA, from about 5 pharmaceutical companies, you alone. So instead of sitting in the office to work, we are moving from one court to the other.
So just walk me through one court case, right? When you go to the court, I know it's a court of law, but is the court empathetic? Do they get your explanation where you're coming from? I sit here and it's sad, and I sympathize with you, but does the court also get what you're communicating to the public?
Yes, some judges are so good, very good. They will ask you go and negotiate. Go and talk to them how you solve the issue. Some judges will just apply the law, bam, prosecute you there, pay some amount of money there. If you don't pay, they will take you to someone.
Happened before?
It's myself. I have been jailed one day. I mean, I don't know whether it was a jail or whatever. I was asked to pay some fine twice because I owe Senate, and as a city, I still owe Senate. I don't have the money to pay. Now I wish any judge would pay me. I mean, about 5-6 months back, I go to pay Senate, pay all those people and be free. But that's my working capital because I'm owing them penalty. We should be allowed to pay the actuals for our people. Why penalty? Why government, you holding our money, punishing us, and punishing us again to pay penalty? What kind of people are we as Ghanaians? Why are we doing this to ourselves? But, you know, a white man comes and we give them free zone, whatever, tax free to operate, take all our money outside the country. And we sit here and we be killing ourselves. Ghanaians, I don't know. That's why I'm saying that I have issued with CEOs and directors who sit in the office saying it is a law. You are there to see whether that law now is working, now it suits the situation in the country or not. Take it to appropriate quarters. Maybe if Parliament, take it there, take it to the presidency. Discuss it. That is why we voted for you. That's why we went there to vote for you. But the government cannot and can never employ everyone in this country. It's a private man who work, open businesses to support the government. And we pay the tax. But if we are doing it, and the CEOs and directors are not creating that environment for us to have, but they create the environment for a foreigner to work, I've never seen this before. I can't go to China or US and go to operate and then they will give me a free zone to operate. What kind of idea is that?
And it's interesting because, you know, I can say without a shred of doubt in my mind that For a lot of Ghanaians, they prefer to go to the private hospitals. They will tell you one of the reasons is that customer service is better than the
Perfect.
public hospitals.
Perfect.
I mean, you go to a public hospital. It has happened to me before, Ridge Hospital, before they got the new building. I don't know whether the new building, their attitude has worsened. I can't say, but even when they were in that old, dilapidated structure, it was so bad. I think one time I went there with somebody, blood all over, and they couldn't even be bothered. Like nobody would even attend to. So we appreciate the work of the private health facilities. Yeah. We know that in terms of customer service, we cannot even compare it to public health hospitals, and it's because they're getting a lot of freebies in the public health spaces. Now, with all of these things, you still say you want to help government ease the unemployment situation in the health sector. I know there are nurses who have sat home for several years. Exactly how do you intend to do this? If you can help us understand and appreciate how you want to help ease the unemployment.
Good. You see, I started saying that the regulatory bodies like HIFRA, see, they have standards for us to work.
Sure.
So if we're a primary hospital, the
standards,
if we're a primary hospital, they expect you to have 24 nurses, 3 doctors to work, and a pharmacist, and that per our level, they have the number of workers that you're supposed to use to work. And any child, before they give you accreditation, they have that. You see, the challenge we are having right now is that if you even get them, ask the nurses at home, if you even get them, you can't pay them. You can't pay them. They will leave. The little we get, we train them when they come out from school. I'm not saying they don't train them well, but when they come out from school, the practical of our aspect of our work, we teach them. We employ them, and then we teach them the practicals of this job. And politics will come in, government says, I've gotten money, so I'll give them the financial clients, and all of them leave. So when they leave...
When you say all of them leave, they leave the private health facilities. They come and do the practicals there.
They leave. At us between now, some of our facilities are, let's say, training schools for these same public schools, of our public health schools. Right? If you take some like Nimwa and Co, some, even my facility, some come there with attachment and all those things. They come, we train them, we teach them, because we have doctors, we have nurses, we have midwives all over there. Now, government, because we can't pay them, you are not allowing us to work. We can't pay these people, we can't employ them. So we don't meet the standard. We don't really have what it takes to to have that standard. So it becomes very difficult to get nurses with PIN. Qualified nurses, they have the PIN. Doctors to come to the facility, very difficult now to get. But when they come, the amount they are charging, because the NHI is not paying you, you don't have money to pay them. So you can't get them to work. And if you don't have them to, Medicare and Dental Council will arrest you. HIFRA will come and arrest you. NHI will not give accreditation. Okay, fine. If that be the case, why are you giving nurses and doctors to CHAG, which is also not for the government, but for a Christian association
group? Yeah.
All right. We are saying that the nurses who are at home, government, you don't have money to even build facilities now. You said Agenda 111, but we all know what is going on in the country now. We have the facilities. We have the facilities. For you not to collapse our business, and for us to help you, so that those unemployed will stop crying that we don't have business to do. Give them to us, so we meet the standard. You see, we meet the standard, so that you, the government, you be free. And once we give them to us, we will pay their taxes. You have your money back. Even if it takes that, we should sit down 50-50. Therefore, we the private, you can't pay full salary of them. As we are doing in CHAG, we can sit down and negotiate.
I think part of the salary will come from government.
Yes, the salary will come from government, and some will come from us, because we have the facilities, and people are at home crying. They don't have work to do.
I don't want you to move on, because I really want us to understand how the salary works. So you're saying that you have the facilities, government, so instead of staying at home, we can offer you this amount.
Yes.
So come in and government pay half of it.
That's it. So this unemployment will be a thing of the past. No worker will stay at home and say, because In fact,
And that is because if you want them directly, the amount they would be demanding, the facilities will not be.
we can't pay. I give you an example. If you have 24 nurses as per HEFRA
Yeah, you
standard,
gave an example.
then they are taking
24,000.
1,000, even 1,000 cities, 24,000 a month. Plus the doctors and other departments. It's not easy. And if NHI has not reimbursed you, how do you pay them? And nobody will stay in the facility without salary. You see? So government, they are crying. They are at home. They have no place to go. We have the facilities. They are there. Let's sit down. Post them. So you get that standard. You, the government, get that standard you need. What can go in? What can come out? What can we do? All of us will think through. So that you give them to us. Then we move on as a country. So why would the facility be there? I've got a huge facility. And because the NHI is not paying me, nurses are at home, I can't employ them. Does it really make sense? Does it make sense? They are at home. PAs are at home. Doctors are at home. Nurses are there. Midwives are there. Meanwhile, a facility saving life somewhere has no midwife. The midwife is at home doing what? If you go to the public facilities, there's a small facility at Pokuase. Over 50 midwives. They come to work. Somebody comes to work once in 2 weeks, and they take full
because it's a government facility.
Why? Because if you go there, government is still posting them to the public facilities, and they are there. And somebody comes to work once in a month.
Yeah.
Doing what's there? Meanwhile, the private man there saving same life that you, the government, you want. You want to achieve universal health coverage, as you are saying. Without us, how do you achieve it? Well, look, if you go on the DEMS, what we submit to the Ministry of Health, private will be over 40%.
Okay.
40%. Wow. Even all of us have not even gone there. Not all of us submit their monthly reports to them. If we are all submitting, we will be more than the 40%, because we are the second largest apart from a Ghana Health Service. Right. We are over 1,000 facilities. You see now, and look at the number of people we have employed, the number of lives we are saving, how we are helping the government, and government has no help for us. Only thing government can do is to prosecute us. That's all.
Okay, so we'll still talk about the issues, but let's talk in terms of numbers. Averagely, if you were to help government take on board or absorb some of the nurses who are sitting now, how many are we talking about?
We can take over 40,000 nurses. Because I know some facilities in Nimwa, Kenop, Jubilee, community groups or hospitals, they are big facilities. Their bed capacities are over 200, 300. So such a facility will not need less than 100 nurses. Only one facility. You see? And we are spread over family hospitals and co, St. Luke's groups and co. You see, so big facilities. Look at Nyaho, La Paz community. You look at Anton Memorial Hospital. A whole lot. Crystal, whatever. I mean, Trash Hospital. Look at them. Big facilities. We can employ over 40,000 nurses, and we can absorb all of them at home. If the government should sit down.
Here's the thing. It's funny because I actually don't remember the last time I went to a public hospital. I don't know if I've been to Kolebu, so I can't say I've never been. But here is it. I've never even gone to Nyaho. It's one of my hospitals, and used the NHIS card. Yes. Because of the perception that when you use NHIS cards, first of all, you have to be in a long queue. They don't attend to you properly. And so people shy away from using the NHIS card. And I'm one of those people. I've never used an NHIS card in my life.
Why haven't you used it? You have to use it.
Because I don't want to join a queue.
No, you not join a queue.
Because I don't want anybody. Because as soon as they see NHIS,
no, it's because NHIS is not paying.
Eh?
What NHIS is not paying? Other insurance companies, though they are not paying, but some are better than NHI, right? Due to their issues, some are better than NHI, and some of the facilities prefer cash down acute service because the doctor coming is taking his money. Anesthetists entering the theater will take money on the spot before entering the theater.
That I am aware.
You see,
I'm aware.
That's our problem. We are anesthetists entering the theater. Give me money before I go. You don't give me money, it's not going.
Yeah.
So
and they charge so much per service.
Exactly. So if NHI has not reimbursed you, how do you pay the anesthetists? You need to save that life too. So it's like if you have money, pay, let's give you the service and save your life. See, and NHI, their services. I mean, I'll say all the insurance companies. If you look at them, what goes in the services, right? Like cesarean, operations, if you look at doctor coming, how much is charging, anesthetist charging, cotton and other things you use, the setup of the theater, what goes in there. The amount NHI is giving you is so meager. It's so small. The services they give us so small. The drug tariffs, I'm dying. Now they just give us a new tariff last month to use. The dollar was somewhere 7 cedis, and the dollar is more than 10 cedis now. Every drug component and non-drug component has been increased. What are we doing to ourselves? So you go and buy drugs on the market for 10 cedis, government is paying 3 cedis.
So what's the way forward? How are you going to overcome this bridge of having to engage government to get the nurses? How are you going to do that? Does that also include going to Parliament?
We've sent a proposal to Parliament.
Okay. And
Parliament
you got a response?
Yes, we've got a very good response.
Okay.
Even today, I had a call from the Minister of Health that tomorrow we should sit down on that.
I think I interrupted. You said you sent the proposal to Parliament.
Yes, Parliament.
What did it contain, and what is Parliament saying?
You know, we went to Parliament, and then Parliament asked us, what do we have on board for government? We should convince them why government should give us the human resource. And we have done that. We have convinced them. Achieving the universal health coverage, those at home, we can employ them. As like you scratch my back, I scratch your back. You see? And a whole lot of things that we've sent to Parliament. And Parliament is really happy, and they've seen the sense in it to engage the private. So last week we were all in Kumasi. The private Ministry of Health, skill gap, workshop, how we can give them data, wanting to know how many people we use in our facilities and how they can help us. So, the government has responded, and we hope that the response will be good. That's how we want it. We bring the problem, we all, we sit down and we discuss, then we see the way forward. So we are counting on them.
Well, and you said you received a good response. What did it contain specifically? What was it?
In fact, they've asked us for a meeting.
Okay.
One of the responses to go for the skill gap meeting in Kumasi. And now, whilst we're going tomorrow, we will see whatever thing they're going to tell us. We also wrote to Parliament about the Senate issues that we were talking about, GRA and all those. We've sent all those things to Parliament.
Right.
And then Parliament is really working on it. But they've seen the sense in what we are saying. What we are saying, in fact, it makes so sense.
Parliament is more forthcoming.
Yes,
is more
forthcoming. Because
progressive.
The select committee chairman said, how? That if we are
on
not
health,
them,
select
on
committee
health,
on health.
Yeah. And I cannot. Even I love them, and the lawyer there, I love them so much, all of them. If you are not paying them, how do you then go and persecute them? They have not said anywhere they won't pay. We have not said anywhere that we will not pay our taxes, we will not pay our bills. How? And why on earth would you pay this? Pay taxes. Why won't you pay? But the thing is that you are not paying me. You are supposed to pay me. You are not paying me. But you want to slap me double and take the money. Because you have the upper hand per law. But the lawyer said, but the law was made for us. Why do we sit down for the law to kill us? So that is what we are doing now. So back to your issue. NHI is good. I tell you, it's one of the best policies we should all hold, bring it up, help. NHI, I will cry when NHI collapses. Because we those in the hinterlands, we know what NHI does for people. Right. You see, that's for Ghanaians. But those in the cities, maybe you have the cash to pay. As you say, you go to Nigeria. So you have the cash to pay.
The stories are just too many.
Yeah, you just go and pay. Yeah. But if you happen to go to the
I know it's important. My grandmother could afford, but she was always using her health insurance card.
NHI is best. We those there. That is why we those in the hinterlands, we suffer and we cry all the time. Because our services are solely NHI. The person who is coming even does not have the money to pay. So how then do you ask the person to pay? Okay. And the person is sick.
Okay. Unfortunately, we're running out of time. But I just want to talk about a bit about your drugs. That your pricing is different from what's given to the government facilities. Is that it?
Yeah,
How so? Yes. Why is
ours
that?
is a little bit up.
Why?
Up than,
Why?
Because we pay our salaries, we do everything. So ours is a little bit up.
Why? But why are they giving you drugs and yours is higher if it's the same drugs?
No, is it the services? Is it the services? Our service tariff is higher than.
Because of that, so your
yes,
drugs too.
Yeah, the drugs even are all the same. It's only the services that are up.
High.
But the drugs are almost the same.
Oh, okay.
And the drugs, the challenge is that because the dollar is not stable, we can't have a fixed price for the drugs. It's always going up, and so.
And from where? From where?
From we buy it from the open
source.
markets.
Oh,
but
okay.
But the government facility takes from the medical stores.
Right.
And that's what we are also saying.
And there's stability there.
Yes, so we also want to go to the medical stores. But if you go, they say no. You're a private man, no, they won't give you. So go to the open market. And the open market, you go, the price is different from the medical stores. So anytime we always tell them that don't expect that we can give the same service as a government. Because I cannot go and buy the drugs at 10 cities on the market. I come and sell it for 7 cities. And you expect that I shouldn't take my 3 cities difference. I'll take. If I'm not breaking even, should I lose? No. I can't lose. And that's the challenge we have with NHI. And even that, public for facilities, whoever, everybody is doing the top up. Because the public too, they also have to break even. They are saying that it is a non-profit, whatever. So why are they taking it? Me, a private man, if I'm taking it, why are you also taking it? If you are with me, if you go to Kelebu, you pay.
Yeah.
37, you pay.
Yes.
Rate, you pay. There's no facility in Ghana here, what's a government facility, that if you go, you don't pay money. Yeah. That one, NHI can do nothing to them. But if you're a private man, who is even begging a client to come to the facility, because for us, if the client do not come, you have nothing, or you lose. But the government people, they don't lose anything. So whether
somebody goes or not, they will come.
Good. The client is our heart, it's our money. Yeah. So we wish we will not take even a penny, so that all the clients will come to our place. Yeah. But the system is not allowing us to do the right thing. The system itself is corrupt. You see, the regulatory bodies are not helping. The CEOs and the directors on the regulatory, they are not helping. The laws they are giving us are too much for us to function. And that's why we want to sit down with them and give us a good environment to work, so we can even employ more. Even if government is not supporting us with the human resource and the environment is good, and you can employ, pay your taxes, pay everything, and then go on.
Okay, Samuel. Thank you very much for joining us on One. I have learned a lot, especially of the challenges and frustration within the private health facility. It looks like government is frustrating, but then at least there's some light at the end of the tunnel. Parliament has responded positively to their concerns, and they are willing to engage them and see what happens next. How soon are we supposed to get a response? How soon are you supposed to?
Let's see by next year.
Next year
we are itself paving our way through. So maybe by next year.
All right then, and that's for nurses who are at home, especially this is a 911 or an emergency call to government. That those nurses who are sitting at home, you hear 2019 they haven't been posted. Quite recently there was some who picketed, I believe the finance ministry or the health ministry, that they hadn't been posted and they wanted to be posted. All that could be a thing of the past if you engage the private health facilities and meet them halfway. My name is Bridget Otu. I hope you enjoyed the conversation. This has to be, I think, my favorite interview since we started One, and it's because it goes to the hearts of the people, the patients, and yes, health is life, and we hope that this has breathed life into you. See you next week.